First of all, thank you all, Jonah, so much for joining us for our conversation this evening with Juliette Kayyem in partnership with World Affairs. I'm Thomas Zimmerman. I oversee programming here at the Pacific Council for those of you I have not met. And tonight's event is titled Life After COVID-19, which I recognize up front is a bit of a misnomer.
Yes.
We're at a time where we're all coming to terms with a reality in which we're going to have to learn to live with this virus for the foreseeable future. But now is a time when we must start thinking about, how do we prepare for the months after this initial outbreak, and what should we expect from our leadership at all levels? So to talk us through this, we are extremely fortunate to be joined by Juliette, who has a depth of experience organizing government responses to major crises at both the state and federal level. She's currently a professor at the Harvard Kennedy School of Government, where she is faculty chair of the Homeland Security and Global Health projects. Previously, she served as President Obama's Assistant Secretary for Intergovernmental Affairs at the Department of Homeland Security. The Department of Homeland Security, and also Homeland Security Advisor to Massachusetts Governor Deval Patrick. And then on top of all of that, she's also the author of the best-selling book, Security Mom. So just a little bit of housekeeping. Juliette is gonna make some initial observations, and then we're gonna open this up into a conversation, and you can submit your questions. If you look down at the bottom of your screen, you'll see a Q&A box where you can submit questions at any point. So I'm going to disappear for a bit, but in a moment I'll come back, and feel free to pose your questions now as Juliette speaks, and then we'll get those questions answered. So over to you, and thanks so much for being here. I really appreciate it.
Oh, my pleasure. My pleasure. We're you're hearing the family finish up dinner, but I am so thrilled. I used to be a member of the Pacific Council. My inability to travel as much as I wanted to meant that I'm no longer, but I'm a huge fan of the work that both organizations do. I am a child of Los Angeles, the Westlake School that's now Harvard Westlake, and so just glad to be beaming into you in the way that we do these days about the pandemic. So what I thought I would do is sort of let's just, the headlines are the headlines. We sort of know what's happening. If you're following the news, you have a sense, new news today about President Trump stopping funding for the WHO based on his allegations that the WHO was very slow in responding or providing intelligence to the United States. An allegation that I have to say is, we got the same information from WHO as South Korea, and those are very different stories of what happened to both countries. But I think, and all the challenges with the governors and distribution of the supply chain and medical gear. Okay, so we know that that's going on. We know what the issues are, and sometimes we know how to solve them, and sometimes they're just political debates. I want to do what I think I did for a lot of people before we got to this moment, which is sort of brace you for impact. About 5 or 6 weeks ago, I've been documenting this for The Atlantic, which has just a tremendous series of articles by its staff and others about the pandemic. If you get an opportunity, their firewall is down. And about 6 weeks ago, they asked me to start memorializing what I thought was likely to happen, only because I had been involved with H1N1 and had been sort of publicly commenting about my concerns based on just public information of what was happening in China. That first column was titled, America, you have no idea what's about to happen. And it was just about that this was about to happen, that the only way that you could deal with the pandemic was going to be very aggressive social distancing. We had already seen it in China. At that stage, we were starting to see it in Europe. So now I need to brace you for the next 2+ years and this idea of normal. It's really hard to get our head around it, but there will be a moment in which there will be reopenings. I don't think it's today. I don't think it's tomorrow. Governor Newsom in California, as you all probably following, is basing it on, as any person should, on metrics, on what are the metrics to get us out of this moment, the aggressive social distancing moment. Because remember, the reason why we're here, right, is because we only had one tool left to deal with a pandemic whose case fatality rate, CFR, we did not know, right? In other words, is it 6%? Probably not. Is it 1 to 2%? Probably. Could it be less than 1%? Maybe. Germany's showing numbers like that, but we don't know, right? And we also know that because of the nature of the ailment, it was requiring to survive it. In other words, to lower the case fatality rate, you would take aggressive hospitalization. So, the rest is history, as they say. We had one tool to flatten the curve. So what does a flattened curve look like? A flattened curve is longer. Sometimes people forget that, right? A heightened curve goes through a country, kills a certain number of people, makes immune a certain number of other people, and then you have, herd immunity, and then your curve is over, right? A flattened curve, remember, is long. And so once we come over this and we start to open up, what does it look like? So the first thing to remember, and this is how, and remember, I'm not a doctor, I'm not a scientist, I'm a Homeland Security planner. I think about balancing security with homeland needs, right? So obviously the economy, transportation, travel, all the things that we want to do that we're not doing now. How do you balance those against the security needs of protecting our populations and obviously protecting our healthcare facilities? So the opening then will not be a light switch. Hopefully most of you know that by now. It is not an on and off switch. There's no sort of moment in which we're going to all come out of our houses and relive life as we know it. The way to think about it, I think a lot less helpfully, is a little bit like whack-a-mole. That what we are going to experience the next 2 years is something that we've never experienced before in disaster management. In the past, in disaster management, we have, you have a response, right? The hurricane happens, you have a response, and then you have a recovery, right? So you have the hurricane ends, you save as many lives as you can, and then the recovery begins, say 24, 48, 72 hours later. The bodies are picked up, the debris is picked up, and now you start to rebuild. What we're about to experience is a simultaneous response with recovery because we don't have a vaccine. Remember, my 2 years is wishful thinking not wishful thinking, but keep my fingers crossed, is we have a vaccine manufactured and distributed globally. That's my end date. That's my cure date. That's my true recovery date. So what am I going to experience between today and my true recovery date? And I've given it a name because I don't know what else to say it, and it will be in my column tomorrow. And it's we're going to enter the adaptive recovery stage. Not very unique name, but it's not recovery. It is adapting to some semblance of recovery. It's adaptive. We're going to be, so what's going to happen is states and localities will prioritize where they open, schools obviously first, other essential needs. Businesses will have a huge ownership of how they open, also dependent on testing, tracing, all the tools that we've already become familiar with that we need. And then there'll be tertiary, third, fourth, fifth tier openings up. And how we'll experience it is as having a series of tools available to us, right, in this period, I'm gonna call it 2 years now, that make it easier to live and manage and dance and work around the virus, but will also mean that the virus is that the hurricane is ongoing, right? So we've never, as citizens, we've never dealt with this as a crisis management, Homeland Security apparatus. We've never dealt with this, and so it's just something to think about in terms of how you're managing your life, right, and how you're thinking about your life. So I want to put the economics of this aside, not because they're not essential. It's because I don't think they're in conflict. People will talk about, well, the economy is in conflict with the health needs. It's the health needs, right? A healthy society is one that's economically resilient. No one who is promoting strong social distancing is immune to the argument that this is really bad for the economy. We know that. The alternative, though, a virus that is not managed is much worse, trust me. So we're going to get to a stage in which we find an acceptable balance. It's going to take more aggressive testing, tracing and tracking of family members, quarantines, which may be forced. It's going to take creativity by the by employers in terms of providing resources for employees, when we'll probably see laws that address this, because you're going to want employees to come forward. But we'll experience it also, not just in the public sector space with colleges and schools and universities or in the workspace, but I want to end with how will we experience it as us, right? Huge amount of our lives were not in a public space, right? And a government space, nor at work, right? How will you experience it? And this is where our own risk assessment will come into play, and where I sort of thought that the debate about we're opening up seemed kind of crazy, because let me ask you, would you go to a concert right now? Absolutely not. None of you would. I know it. I mean, we'd like to, right? Would you go to a restaurant knowing what you know about our capacity to trace it? No. Maybe in 3 months, you might think about it. Maybe in 6 months, you might go to one that has half the number of seats. It's gonna be a long time before you go to a concert, though, I would guess, or an opera, unless something very aggressive is done in terms of temperature controls and passes that would mark whether I was immune or had already had the disease. In other words, our functioning is going to be so different that in some ways I think we just need to get our heads around it at this stage. I think it's the only fair thing to do, because what's going to happen is that when parts of the virus pop up, right, whole parts of a community will be put back into quarantine. A school will close. A school district may close for 2 or 3 weeks. Doesn't mean that your kids aren't in school. It just means all of a sudden now we'll go to whatever they've been doing now in terms of Zoom and online teaching. Your dry cleaner, you may drop stuff off and only to return 4 days later and realize it's closed for 2 or 3 weeks. This is the kind of aspects of how we're going to live for the next couple years. There's no better solution because until the vaccine comes. And where I'm not, this is, to repeat again, it won't be like this though, right? It will be where we're going to be better at testing. We're going to be better at tracing. We're going to be better at quarantine. We're going to have treatments, which a lot of people are really enthusiastic about some of the treatments that are coming down. So it's like Tamiflu. If you get it, you immediately take the treatment and maybe you'll be better. We will have more deaths though. I mean, there's no question about it. And whether it's 60,000, which I think is remarkably low, or 400,000, which is the range that a lot of people put it in, there will be, all of us will be touched by this on a personal level if we haven't already. So when you hear politicians and governors talk about opening up, my sort of take is opening up to where, right? And so that's where we're heading, is this adaptive recovery stage that we will learn to live with a very deadly virus in the best ways that we know how to, in terms of making it manageable. So I want to end with some, I don't know if it's positive, but just a way of addressing how to ground ourselves in this. Because that's important. As someone who thinks about Homeland Security, look, we want to move forward. Homeland Security is about, not just security, but the flow of people, goods, ideas, and networks, as we think about how do you get societies to move while still being secure. This is going to be a very, very hard balance. But you'll hear a lot about the new normal, or some companies that I advise are talking about the next normal, right? I think a better way to think about adaptive recovery is actually the now normal. That I've come to believe that we will experience each day as having the potential to be very different than the day before. Once again, we're gonna have access to treatments, access to testing, all of it, but it will have the potential to be different, and therefore normal is today. It's a very strange way for us to live. We like to plan, we like to think ahead, and we still can do that. We absolutely still can do that. But it will be a remarkably fluid couple years ahead. With less risk than we have right now, more capacity than we have right now, but certainly one that is going to feel like no other recovery this country has gone through before. And I just think that all I can tell you is honestly what it's likely to look like. Brace yourselves, prepare your families, but it will be fine because we will be able to anticipate that now normal, no matter how it shows itself every single day. Okay, so that's what's next. That's why we titled it this. And I'm happy to take a million questions or however many you want. Thank you. I think I ended just on time. Yeah.
Thank you for that. That was fascinating. So first, as we get started, if you want to submit a question, once again, look down at the Q&A box at the bottom of your screen. The questions are coming in right now, and I will read them aloud. So first question we got from Alice Wong. We're hearing a lot right now from governors saying, we have the ability to open things up. The president, has total authority, whatever. Who is it who ultimately gets to decide the ways in which we go back to work?
Well, the president backed down today. So basically, this is, the line in Homeland Security is the security is the easy part. The Homeland's the hard part. We have different governance structures in this country. We are built, in some ways you could say we were built unsafe. The 10th Amendment reserves to the governors, and I was a state Homeland Security advisor, so I know this fight well. Reserves to the governors control over public safety, public health, quarantine laws. So the governors have a space of control, and they are the ones who enforce things like the school rules or statewide curfews or social distancing. Cities also have authority in this regard that's delegated from the state. So so that's why San Francisco was able to lean ahead of California. And when the storybooks are written, London Bree should get a chapter. I mean, everyone thought she was crazy. Remember when she went out so far ahead? The mayor of San Francisco was leading. Let's just put it that way. As was the governor who came on board just I think a few days later. Your governor. So the governors assert this. They can get guidance from the federal government, which they would like because it helps with liability issues. In fact, it would have been good for the federal government to have a unified plan for closures. We still have 8 states that are not under any closure rules. We have no idea what their numbers are. Let me tell you, their numbers are not zero. Their numbers are not zero, right? This is the red state, blue state divide that's going on now. But what happened so what you had a 50-state disaster, right? All 50 states were activated because we're all impacted, being run 50 different states, right? Not ideal, especially for a pandemic. So you're seeing a lot of coordination on the East and West Coast, amongst the regional governors to try to come up with regional plans for opening up. Here where I live in Massachusetts, I can be in New Hampshire in 30 minutes, Connecticut in 40. So it'd be good to have regional planning, right, around a response. So that's basically how it works. The president realized it today in his press conference. He said that they were going to provide guidance. This is sort of perfect. Provide guidance to the governors about how they can open up once it was safe. Well, of course. I mean, that's like what the governors were going to do anyway. So the president did back off.
So we got a couple questions about the WHO and the president's move today. First of all, is there any credibility to the charges that the president is making about the WHO not being in their reporting? And what impact does a withdrawal of funding to the WHO have on their ability to operate?
It's really bad. But I want to be clear here. The president has been known in the past to make sweeping statements, like withdrawing from Syria, that once, within 24 or 48 hours, are either not true or not executed on, or, Congress comes in and asserts something else. So the reason why it's bad is you have no governance entity over global health except for WHO, and we're in the middle of a pandemic. So But I always, with President Trump, you always, you need to go back, right? And so I'm sort of curious what this might look like. Congress could authorize the funding, and there could be a fight. And my guess is that's exactly what's going to happen. Then the White House is going to back down. And we've been through this rodeo before. So that, that's just him. I think that's, as the numbers are bad. I know that there's like this theory, like they're not that bad. I get it. When you have a number like 1 million dead, everything seems better. I don't buy into that. I'm not going to buy into well, at least it's not 1 million. We are the worst so far. I mean, in terms of the number of deaths, although China probably lied about probably did lie about their numbers. But anyway, so that's just something that, I'm sort of part of what I think when he blames the governors and then he blames the WHO. And then the question of how fair were the allegations. So this is the problem when, the response is, let me withdraw money from the WHO, then everyone has to defend the WHO. I'm not particularly interested in defending the WHO. They did make mistakes. But they did not make a lot of mistakes. And they did not make so many mistakes that would that would explain how bad our response is. We got the same briefing from WHO as South Korea did, same exact day. You saw what their response is. For 6 weeks, the White House denied that this was a big issue after having been told by WHO, and now we know by internal intelligence agencies and internal health agencies about what was about to happen. But the WHO was not perfect. WHO was not perfect, has not been perfect in every pandemic. It was slow to declare a pandemic on this. They did have to balance politics with China, with the need, because they wanted more transparency from China. If there's anyone to blame, I mean, blame doesn't get me respirators, right? So in some ways I'm like, let's do that later. But obviously there ought to be a reckoning with China. Whatever transparency they had later on, and most people who I work with have been pleased with China's transparencies, especially on the medical side, I think because China realized what went wrong. And it's not clear that the edicts to remain quiet were coming from the top or if they weren't regional actors, but China knew for a long time, or people in China knew what was happening in Wuhan, and hid key features of what was happening. And then of course, that they were seeing evidence of human to human transmission, which was the game changer in terms of pandemic.
So we've gotten a few questions about, what a new normal looks like.
Yeah, now normal.
The now normal. Julie Waxman's asking, when we look at air travel, everyone's put in a metal tube.
Yeah.
What does that look like going forward? And then Mark Diamond asked, we have a lot of folks in our network who are professors or work with universities. Like, at what point are universities going to be able to reopen dorms?
I'll be totally honest with you. I mean, there's no other way to be. I advise both, right? Okay. I don't see, I'm being quiet because I have a daughter at Brown. I don't see how colleges and universities open up this fall, residential. I think K through 12 can, because you can, and this is what Gavin Newsom was saying, that you just have to redesign the rooms, test the teachers. I don't see how residential colleges go back. I really don't, until January, until we have stronger testing protocols. And anyone who has kids in college or is in college, read between the lines of the emails you're starting to get. So most summer programs have been canceled, and then the university president will, generally say, we are assessing. It's just, it came, July is really soon. Right? I mean, if you think in Massachusetts, we're not hitting peak until May, right? So I'm here 8 more weeks, right? I don't know how long I'm here, but I'm here. If we're not hitting peak till then, I don't see how anyway, that's my personal feeling of what's about to happen. And that's going to be very hard on colleges and universities because students will want to withdraw. They're not going to want to do online teaching. They'll defer a semester. You're going to have a whole new class coming in. Does anyone want to start their freshman year like that? Airplanes will be interesting. I think you'll see testing, temperature testing before you get on an airplane. You're going to have the equivalent of a pre-clear, TSA pre-clear for those who have either had it or who have had the antibodies for it, and who pass a temperature. So you'll literally have a burden and unburden class. It will be a class-like structure. I mean, it will be those who are sick and those who aren't sick. I think I think international travel, and this is just me. I mean, and part of this, remember, is my own risk assessment. So, you know, I'm the mother of 3 kids. I'm 50 years old. I hope to live a couple more decades. Like, what's 2 years not going to a restaurant? Like, I can handle that, right? Or meeting girlfriends for a drink, right? So part of it is, do I really want to get on that airplane, right? And so, so I think the airplane travel is going to be really interesting. It'll be seats divided, probably requirement of masks on an airplane, and really weird border controls in other countries. I mean, in other words, clean countries are going to look at us. If you're New Zealand right now, what are you thinking about Americans arriving? You're not going to be that happy. Hate to say it, but that's where we are. So those are how I think about those. And we'll travel a lot less.
That's fascinating. I mean, it's interesting. You talk to folks in Canada and elsewhere, and there's, concern about states as a source of this now in a way that is entirely new to us.
No. We're until we can get an adequate testing regime. Why, if you're Germany and you've overcome, you're on the other side of the curve, 10 Americans who are carriers could be the difference between your country going back in to isolation or not. And remember, we now have evidence of countries that have come out too fast that have to go back in. Japan, obviously wanted the Olympics to maintain. That was crazy. I mean, I was tweeting in January, like, can we just, postpone the Olympics already? Like, because you just knew that the pressure to try to keep it going. So, so they're now back inside. Japan's back inside. National stay at home right now. As I touch my face, don't follow me. Sorry.
I know. I've never been more conscious of how much.
I know. I'm talking about not touching your face, and I touch it.
So one question we've gotten from a number of people is like Scott's. Putting on your Homeland Security hat. Obviously, the threats that were existent prior to this outbreak are still ongoing. Yeah. Are we additionally vulnerable now? Like, what are the particular threats that you're keeping an eye on?
So I got hurricanes. So the most important is I have hurricane season. We've had some tornadoes the last couple of days, but I have hurricane season starting June 1st. So if I'm actually at the Department of Homeland Security, that's probably my most immediate concern. And I think it's supposed to be a medium to high season. So I'm just thinking about it as resource allocation, just sort of, do I have enough bandwidth to help these states? So this is outside the pandemic. Then, and actually hurricane season, I would just put in the generic sort of climate change concerns. Then my next one is, of course, disinformation and other issues related to the election, but also related to the coronavirus, right? They're, in the same way that the Russians have sort of, taken or have assisted the anti-vax movement that is, prevalent in higher educated areas. Let's just say many people who are part of the anti-vax effort are not low information people, right? So, but the Russians have a strong nexus to the anti-vax movement in terms of supporting these divisions in our society. They are likely to do the same as the Chinese are here. And then I've got the election. So that's my next. So this year, these are the 2 things I'm mostly worried about. Part of it is, will people be healthy and able to vote? I think by then, yes, we'll have, you saw Wisconsin, that was crazy, but I think we'll be able to figure it out by then. I would like to have mail-in voting. I would like to have what do you call it, vacation days or state holidays for it, give people the whole day to sort of, map out when they arrive. But, and then you're gonna have parties vying over, sort of, there's gonna be a whole litigation around the coronavirus and elections and democracy. So we just have to be prepared for it. There won't be, mark my words, there will not be conventions. Not
Yeah.
as we, there can't be, there won't be, there shouldn't be, right, at this stage. So that's what I think about. And then on the far, obviously you always have terrorism and all these things. I think the one thing that I worry about long-term for national security is just the sense of resiliency and competency. We've made a lot of mistakes in foreign policy in our history, right? And we've always made, there's been a not insignificant number of wars that we shouldn't have gotten into. It's more, everyone looking at us knew that we were a divided society, and that we would become united, or the hope was always you become united when we were faced with a common threat. And that's, and that we would be able to rise to the occasion. Well, if we end up being the worst hit Western democracy, unable to overcome our political divisions, with a president who, is our president. I won't be political, it's just, is not reflecting, I think, a sense of unity for the rest of the world. I do think that will have long-term implications for America in terms of our relationships to the outside world. Now, remember, I put all the economic stuff outside of this. It is not that it doesn't matter. It's literally, I think a healthy society is a resilient society and therefore economically stronger. I don't see any alternative to what I've told you how it's going to look. You cannot open up with a live virus, killing virus, without some sort of treatments or something, and we're just very slow on it.
So I know that this whole economic question is a whole other bag. We got a few questions kind of about what does the economic trajectory look like, but a part of that is also what does the next phase of the federal government response look like? There's talk of another package. Like what are you hearing in terms of what we might be seeing?
And that I can answer, and this is definitely not my area of expertise, but I'm glad that you asked that these questions, because I think that those who are pushing for opening up, which when you really press them, just like the president today, they'll say open up responsibly, is they don't answer two questions, which is from the Homeland Security perspective, have to be answered. One is, how can you have a functioning society if your healthcare, right? If your healthcare system is under so much stress that it cannot function outside of that pandemic. No one is having surgeries anymore, right? No one, we are unhealthy. Think of the dental appointments, our entire system is on hold right now just to figure out whether we can handle this. So that's one thing. So that's the first thing that the let's get out sooner rather than later crowd has to answer. And then the other, of course, is it economically feasible to have a society, to plan for a society economically where you have randomness of death, and I'm being pretty hardcore about it, but that's essentially what it is. So think about the supply chain of meat. Everyone's probably following what's happening. A company does not protect its employees, is not notified to protect its employees, to be fair. 300 people test positive. 5% of our meats come from this one company, and it has to close down, right? It's just, rather than having a system in which those people were tested before, and anyone who had a temperature stayed home, and anyone who was sick, had to stay at home but was covered, think about those. So that's it. So, but I think we're working, from what I hear from people I think we're working anywhere from a 60 to 70% economy and not 100%. I think companies will probably be able to figure out ways in which they get back to normal. Smaller companies, maybe not. I think a huge part of it is going to be the other things, right? It's going to be the extent to which our own personal preferences not to expose ourselves are going to have an economic impact. And how do we measure that? So that's just, I don't know how you measure that. I think there will be additional stimulus packages, and the most important one is for local and state governments. Our kids have got to get back to school. These local taxes are being killed right now. I don't remember what the number is, but so we have to get support. We had nothing in the packages was for public support. If, most states are requiring balanced budget by constitution, the only way you do that, if you are in the situation you're in, is you're going to have to take from essential services. We are going to, the next piece of this is going to absolutely be some sort of bailout packages for local governments. Has to be.
So, we talked about the United States a lot, and Marion Christensen asks, this is going to start breaking out in places where things like washing hands is more difficult, where clean water supplies are not reliable. What does this look like as it continues to spread beyond countries that are connected to international?
Yeah, and it's already there, right? So, and then the idea of 6 feet is very difficult in certain countries. So, in certain areas. So the alternative is a much more, and I just have to be honest, is sort of the deadlier alternative, which is, you wait for it to pass through your population until it has herd immunity. And that's unfortunately what you're probably going to see in some countries. So, and which essentially we'll get to that here. We're just going to do it slowly in some ways, and we're going to have more treatments to protect people. But our ultimate goal is a certain percentage is going to be immune to it, so that we feel confident until we get the vaccine. And that is unfortunate. I often say, I teach in crisis management, and we think about Haiti and the earthquake, or New Orleans with Hurricane Katrina. A crisis hits a community as it is, not as we want it to be, right? And it's going to exacerbate all the things that already exist. All of those here in the U.S., income inequality, healthcare disparity, and it's unfair and it's horrible. That's why you want to support organizations like WHO that are able to provide education and at least some resources. But if you ask me, can we fix those deprivations in time? Access to clean water, space? No, we won't be able to. So instead, it's going to be, really difficult aspects of how a culture gets herd immunity, how a community gets herd immunity. But I will say this, everyone should try, every country should be insisting on social distancing, because even if your number on the other end is still high, it won't happen all at once. And that's a good thing.
We got a couple questions about, once we start getting to a place where there's a substantial number of people who have antibodies who have been exposed to the illness, what kind of incentive structure does that set up where, you can do your job, you can collect a salary if you have gotten sick, but you can't if you have not? How do they control the sort of reintegration to the workforce with that in mind?
People who've been exposed, or they're right, who have been exposed. Mm-hmm. So this is going to be, so I think for a lot of the workforce, there's probably going to be bifurcated workforces. In other words, you could imagine, and I actually already know of a couple places that are doing it, that you're doing half on, half off. So my sister, for example, her work will be, until they can figure out who's who, they'll have 50% in office one week, the other 50% the next week, and sort of think about, she's in the arts, think about how we would structure it that way. So you can imagine, immune weeks, less immune weeks, or the requirement of masks for those who are not, who don't have the antibodies. But it is, that division is, you're going to have I keep going back to TSA pre-COVID, you're going to have a burdened and an unburdened class. It is not based on any constitutionally protected status. It's not based on race or gender, national origin. So presumably these divisions are okay. But how they play out in real time is really difficult to see.
And I know we have time for one more question before I have to let you go. But one question we got repeatedly is, how prepared are we for a second wave outbreak?
Yeah.
And what does the process look like if we have to go back to a scenario in which we're doing the sort of more extreme lockdown like we're doing right now?
Yeah.
What would that
Yeah,
would
well,
make that
so we have to be prepared for it. And then once again, I follow what, like everyone else, I follow what Dr. Fauci tells me, which is it is probably more likely than not, but not determinative that there will be a second wave after the summer. So what do we need? Whatever horribleness has happened so far, it will be unforgivable if by the end of the summer, we do not have a strong testing program, a test and tracing program. So that we can, and then I should say, and then treatment. So I keep going back to treatment because one, I'm not convinced we're going to get the testing system in time. And two, because of just the literature that I follow, there's, cautious enthusiasm for that. It's not great for you to get the disease because some people won't be able to be treated because it will hit them so hard. That's how I would think about the second wave. Is to be able to control it better. But some communities will fail and will have to go back inside. And that is going to be hard after this. I mean, I'll end with this. Like, I don't know. I mean, I know me personally, even though like literally I've been yelling for this for months. I think until a vaccine or very, very reliable treatments, I mean, there's no doubt that entirely how I think about my exposure, and particularly my kids' exposure and my 53-year-old husband's exposure, are different. And my risk assessment is definitely cautious. Even though the likelihood that if I got it, I would just feel like crap for a couple of days. Even though that's the highest likelihood. We're virus avoidance more than anything else now.
Juliette, thank you so much.
Thank you,
this has
everyone.
been
Sorry
incredibly
for the
enlightening.
faces and stuff. No, I'm really happy. I'm going to be on New Day at 6 o'clock in the morning my time. It'll be 3 o'clock there, so none of you should be watching. And I'll talk to you soon.
Sounds great. Take care. Thank you so much.
Bye.
Bye. So thank you all so much for joining us this evening. As I'm sure you've seen, we've moved all of our programming online, but we have a lot of interactive webcasts and telecons coming up that we hope you'll tune into. Fun preview, we'll be announcing shortly that on April 21st, Ian Lesser, Executive Director of the Marshall Fund, will be speaking on how this crisis is playing out in Europe and answering your questions. On April 23rd, we'll have a teleconference on artificial intelligence, geopolitics, and the future of information. And then on April 28th, we'll have a teleconference on democracies in the time of crisis. What's going on in Hungary? Like, how is this playing out in Brazil? Things like that. And as always, we wouldn't be able to do this kind of work without the support of our members and our donors. So thank you so much. And if you are able, please consider supporting the council by donating at pacificcouncil.org/donate, or just come to our website whenever you want to see what kind of programming we have coming out. Have a wonderful evening, and please stay safe out there. We look forward to seeing you in person hopefully soon.